Welcome to HCA 322 Healthcare Ethics and Medical Law. The case: a patient who was both a patient and an employee of Ashford Hospital alleged that his protected health information, PHI, was impermissibly disclosed to his supervisor. Ashford Hospital distributed an operating room schedule to employees via email. The hospital OR schedule contained information about the patient's upcoming surgery. Information disclosed included, but was not limited to, his social security number, birth date, age, residence, insurance, or payments information, former surgeries, former and current medication, past medical conditions, his primary care physician, his personal psychiatrist, and other health professionals that he had seen throughout the past year. The patient supervisor was not part of the OR team or the patient treatment team, but was considered to be in a senior administrative position within the facility. The lawsuit: the patient is suing Ashford Hospital for the improper release of health information protected under the privacy rule. All right. After reviewing both the plaintiff's claim and the defendant's defense, I believe that the hospital was solely responsible for the mishandling of both the employee's personal information and medical records. Both ethical and civil rights were violated. However, the information of the patient should have been given on a need-to-know basis. After doing research, I discovered in the HHS.gov HIPAA for professional privacy laws states that individuals, organizations, and agencies that meet the definition of a covered entity under HIPAA must comply with the rules, requirements to protect the privacy and security of health information, and must provide individuals with certain rights with respect to their health information. With this being said, the hospital is the entity, and the supervisor would be the business associate. However, it also states in its very same source that if a covered entity engages business associate to help it carry out its healthcare activities and functions, the covered entity must have a written business associate contract or other arrangement with the business associate that establishes specifically what the business associate has been engaged to do and required. The business associate to comply with the rules, requirements to protect the privacy and security of protected health information. So basically, it was stating that if the hospital, which is the entity, was using the business associate, which would be the supervisor, they would have to have a written contract or arrangement stating specifically the inner workings of the supervisor and their need to know pertaining to the information obtained by the supervisor via email, which the defendant did not state that they had a written contract or agreement with the supervisor. So, with this being said, I am solely siding with the plaintiff. And in this very same source, it also states, in addition to these contractual obligations, business associates are directly liable for compliance with certain provisions of the HIPAA rules. If an entity does not meet the definition of a covered entity or business associate, it does not have to comply with HIPAA's rule. See definitions of business associates and covered entity at 45 CFR 160.103. Thank you.